And once you get to a point where you're having a lot of pain and as a consequence, you're not able to move as much, what are the choices? Is surgery the only answer? Are there treatments before surgery, or what choices does a person have?
That's a good question. So, as we started with what's bone health, what's joint health. So, to answer to the as a corollary to that, the first steps will be to strengthen that aspect, which is physical therapy. So, a therapist you can work with, which will help you get mobility back, get your strength back, put you into a regimen, improve your diet, lose weight. All these are, I mean, losing weight, of course, is the what is it? How big an industry is that? Because we know that's the hardest part of it's easy to say, but it's extremely hard to do. But that is a key because it's just physics. It's pressure is equal to weight a pound area, and if your weight increases, you can't increase the surface area, so you're going to have more load on the joint and more pain. So work with physical therapy or work with reduction of joint, work with improving your diet. And so these factors are the first line of treatment. Now, if this fails, you can add, and at the same time, depending on how severe your discomfort is, you can take over-the-counter medication. Like in India, it's Tylenol, or you can take ibuprofen or other anti-inflammatories, again, in conjunction with your doctor, because if you have issues like heartburn or GI problems, then you need to be careful of that. So that's essentially the first line that you will undertake. Once you have
And
gotten, sorry, go ahead.
now I was just going to ask that I've heard of people getting different kinds of injections. Is that an option?
Yeah, so that would be, I would say, the second line. So once you have failed all this and the pain is still persistent, your joint will manifest with pain, swelling, and some loss of function. Like you say, I cannot bend it as much, and it's a little swollen, it's painful. Then the next step would be injection. Now, what do we mean by injection? And I'm kind of referring more to the knee joint as such, because that I think is the most common joint we are talking about for arthritis. So the injection is when the doctor places a needle inside the joint and places medicine through the needle, places medicine into the joint. The medicine that we use is a corticosteroid or a steroid, which is a strong anti-inflammatory. And the other medicine is a numbing medicine or a painkiller, which is similar to what your dentist uses when you go for dental work. They inject it, they make it numb, and it acts very quickly, but it acts for a limited amount of time. So it's not like once we put the injection, the numbing medicine would work for 6 months or something. But the numbing medicine helps you confirm as a doctor, as a surgeon, that you are in the correct space, because it works very quickly. So if you inject the patient and then the patient gets up and starts walking and he says, yeah, it feels a lot better, you placed it in the correct space, because sometimes that can be an issue. And the second thing is the steroid is like a anti-inflammatory, just like your ibuprofen and Tylenol that you take. Ibuprofen is an anti-inflammatory, Tylenol is just a painkiller, but they work in the whole body, whereas the injection, the steroid, works locally, just locally. So there are oral medications like a Medrol dose pack, which you're familiar with people take, but I would not recommend that unless you have other issues like an inflammatory like rheumatoid arthritis or something like that. So injection is the next line. And the other type of injection nowadays that we use is called viscosupplementation. So there is normally a fluid in any joint to lubricate it. So if you go back to the ball bearing analogy, whenever you have a ball bearing or an engine or a piston that moves, there is lubrication in it. Without lubrication, no two moving parts can move. Now, the lubricating film could be a cell, just a single cell thick, or just like a micro millimeter, but it does need to be there. So similarly, we have in any joint something called as synovial fluid. Now, in a normal knee, in a young person's knee, it is just a small film that lines the surfaces, allowing it to glide. But when the knee gets irritated, the lining membrane secretes a lot of this fluid, and that leads to swelling of the joint. So when the knee swells up, then it is an irritation and it's a formation of this fluid. So there is a normal fluid, and this actually came from horses. Race horses are very prized animals. And so they would start injecting something that has a composition which is similar to synovial fluid, and that is called viscosupplementation. And there are different companies that make it, and it's the concept of viscosupplementation, or injecting the joint with synovial fluid which is like synovial fluid, or fluid which is similar to what is normally present in the knee. And the hope is that that will lubricate the joint and give you some pain relief. So that would be another option, but it doesn't work acutely. So acutely, I would say that I would do the steroid injection, and then that is the next step in the treatment
So
algorithm.